in the concluding session, the advisor from the Ministry of Ayush is also joining. So before that, if we have any specific points to be discussed as per the trainings conducted in these different sessions, you can have that one. So, any doubts or something like that? Otherwise, you are well versed and everything is clear in your mind.
Good evening, sir. It's a very good opportunity today. Thanks for the wonderful day. Thanks for the resource persons who threw light on the musculoskeletal disorders. We expected an elaborate session on public health aspects of the program on musculoskeletal disorders. That's how to run a campaign or a camp in the community, how to create awareness in the public, how to mobilize the patient, how to document the condition, and to record the follow-ups, and to record the data, how to report the data, what we have acquired, how to monitor the program running, how to evaluate it, analyze the gap, and to adapt such that the program runs in a efficient manner, and how to overcome the limited resources what we have in finance, medicine, or personnel. So if you had some like a light through on these topics, it would have been
it depends upon whatever the existing limitations and the resources available with the different healthcare facilities. The basic motto of this training program is basically to acquaint with the master trainers on the technical aspects of the musculoskeletal disorders. However, we have included one session on National Ayush Mission perspective on the that particular public health program, which is supposed to be run by the states actually. Under that, so there were specific guidelines on that aspect, the modalities of implementations and the reporting system, monitoring and the clinical evaluation. For example, the this WOMAC score and even visual analog scale, everything has been included in that, and even the WHO quality of life assessment parameters, everything has been given, and within a public health resources available at the, whether it is a health and wellness center or in an Ayush hospital, within the existing facilities available, how to report back to the reporting system, also it was part of that guideline. So I think that session could have given you some kind of information on that. So if you have any specific what you call difficulties on that ground, you can air it now, so that whatever our guidelines, according to that I can respond to that.
So the Ayush Health and Wellness Centers were initiated in Tamil Nadu in 2022. You came to my center during January 2023. Only on that day, the 30th of January 2023, I was aware of what I have to do in the ASWC. Only after you questioned me what you are doing, what you have been recorded. Only your visit threw light on what I was expected to do in a Ayush Health and Wellness Center. Until then, I was blindfolded.
Okay.
So I expected that before running a public health program, throwing light on what we are, what is expected from the community. If we know what we are going to do in the community, then we could disseminate the points to the medical officers who are running the program, and better results could be obtained from the community, and that would help in running the program to the maximum benefit. So
one thing I can do, I can throw light on specifically in a public health program mode. Specifically, you have indicated actually the STG, the role of the STG, not only in the public health program mode, even in the regular institutional setup also the STG has to be adopted, whether it is a secondary or tertiary healthcare institutions, whether the Siddha Medical College or even the Siddha hospitals or even health and wellness center, every level of healthcare system, this STG is supposed to be implemented. That is why level 1, level 2, level 3 kind of approach has been enumerated in these SDGs. That is one thing. Whereas in the case of public health program mode, what under National Ayush Mission, what is it is envisaged that there are three aspects that you have to cover. One is the outreach activity. Outreach activity in the sense actually, for example, there is a nodal person suggested for that particular public health program actually. So, he will be in charge of certain blocks or certain villages very specifically indicated actually. So, as per the what you call the population load of that particular block or of that particular villages, he is supposed to cater that community. So, whether he will go everywhere, actually it is not like that. He will be an instrumental in mobilizing the community health officers who are already available in the health and wellness center. So, whether the community health officers every day they will go to the outreach activity, no, they cannot do it actually. For example, if there is a 6-day working in the health and wellness center, at least one day they can go for these kind of public health activities actually. Whenever an outreach activity is being done there, actually they can converge various other activities also. It is only not only for the musculoskeletal disorders. You cannot orient the community only on that basis, only for musculoskeletal disorders you can come here. That kind of approach may not be feasible and it is not practically possible also. So, for that purpose, whatever the public health program which is supposed to be undertaken at the community level, whether it is NCD screening, other NCD screening, not only musculoskeletal disorders, other NCD screening, even if there is a ANC cases are reported to that particular places, that also can be catered by that outreach activity. In that outreach activity, even the support of the concerned ASHAs who are actually accredited to these kind of health and wellness center also can be taken. So, for that purpose you can have a small orientation for the ASHAs also on these guidelines actually, that is one thing. Then that is the outreach activity that we are actually supposed to follow either weekly once, yeah, if the what you call the programs and other exigencies are more, at least bi-weekly this program has to be run. Then whatever the patients are screened at the outreach activity level, at the community level, they will be appropriately guided towards the what you call the hospitals. Where is the hospital? There are two levels of, one is actually your regular Siddha dispensaries are available, yes, Ayurveda dispensaries are available. Another one is actually where the hospital which is having inpatient care. So, as per the requirement and needed, that they will be appropriately referred back to these hospitals, and only you have to ensure also those patients who are actually referred to these facilities are actually going there and taking the services. For that purpose, actually specifically tailor-made referral slip and what you call the documentations are also essential. So, at present, frankly speaking, at present that kind of slips has not been made at the central level, but we are planning for that also actually. Whatever the referral systems are to be specifically done at the community level, at the institutional level, that will be specifically tailor-made formats will be made available to you. So, with that you can have that kind of referral mechanisms easily possible, that is one thing. Second one, if further warrants more what you call specific therapies are required, then you may require a what you call higher level hospitals, Siddha hospitals services are required. So, for that purpose what you are supposed to do actually, you have to identify the cases in which these patients are imminently requiring these kind of interventions, and accordingly that connection you have to make with the higher centers actually. So, there the Tokkanam therapy, where the marma interventions, everything you can do, even the marma therapy, even what I say, it should be mobilized to the community. What we envisage actually too, over a period of next 1 year, we would like to undertake national level training on ectovarmam therapy, because now it is consolidated in southern states actually, that is what I understand actually. Maybe in Tamil Nadu, Kerala or some other states, it is separate groups are practicing the varmam therapy. So, even within the system also, outside the system also, that means within the Siddha or Ayurveda, where the so called strength for Varmam therapy, it is there actually. There we would like to make a national level training program for the Varmam therapy. That is one target we are keeping. Second one is actually the strength of, I do not know in Siddha whether it is used, Agni Karma in Ayurveda, that we call it as actually. So that the same interventions if you can do for the, particularly the pain management is a challenge, particularly for the Chuttige, okay. So that also we would like to take an as a national training program for these two programs. Already we have discussed, the finite modules is yet to be prepared for that purpose. So once it is prepared, actually you can assimilate these strength also into your whatever the musculoskeletal disorders, STG, as a part of that actually, and you can advise the field level physicians to practice vigorously all these aspects. So I think this is the broad format in which this public health program is supposed to move. Until and unless the entire gamut of services are actually made available and make a very conscious awareness in the community, these programs cannot sustain. That is one. And regular institutional mechanism is also very important, because that is why now the support from the National Ayush Mission level is limited to only limited manpower. But what you are required to do is that existing regular manpower has to be mobilized to assimilate these functions. While carrying out these functions, they are also appropriately oriented. So based on that, I think over a period of, I envisage that within next 1 or 2 years we can stabilize these programs in the field, particularly in wherever this disease burden is actually more. That is, I think we can have with appropriate training. Any other comments on this thing? Okay, so how is your now dispensary is functioning, Chellampatti?
Yes, sir.
Is it improved after?
Very well.
It is improved over last.
It has improved.
Okay. So any referrals are happening there at that level?
In the maternal child health is
Hmm.
and in NCDs is we are referring them to the PHCD, which is adjacent,
Okay.
and not the other cases. Like I have referred a cancer patient
Hmm.
to the high center.
Mm-hmm.
Nothing else.
Okay. So what you feel, what are the challenges for the field level functionaries in implementing such kind of public health program? You can continue this.
Good evening, sir. Public have their own perspective of, about coming to Irish system of treatment and allopathy system of treatment, because they have the perception that long-term cure for long-term diseases could be obtained from Irish, not for acute diseases. So perspective is one main thing that we feel it hard for us to mobilize the patients to our center. And ASHA's, like WHVs, Women Health Volunteers, are working towards mobilizing the patients towards to us. They give many referral slips to the patients who they identify as will be getting better treatment from Irish systems of medicine, but people don't turn up to us. They directly go to modern medicine. And another thing is, in the MCH program, even after making many calls, mothers don't turn up to get the next level of medicine. Like, you know that we are distributing 4 kids, Mother Baby Sanjeevi kits, each for 3 trimesters and 1 in the PNC. And we are ready to provide the same mother with all the 4 kids, but making them come to pick up the next kit of medicine is very hard for us.
What do you think that, what is the reason for that actually? Because if it is having one is in terms of efficacy, one is in terms of palatability, third one is on the ground of availability. So if any issue on these 3 grounds?
Sir, palatability is not a matter, because all our medicines are palatable, and availability, like availability of medicine is not a matter. Doctors are available, but mothers are provided with monetary benefit in the general system of medicine that we don't provide.
Okay.
That is also another.
So the programs like JSSK and other things that you are suggesting
like
actually.
Ministry Ready Fund, they are getting 16,000 worth of money and goods. If they don't come to the clinic, attend the clinic, they will be getting the monetary benefit.
Okay.
So patients, mothers are adhering to their system of treatment, which is lagging here.
I would like to ask you only two questions. One is about your school health programs. Actually, when I visited their clinic in Tamil Nadu, actually at that time she was having that kind of mentorship program for the school health program, and she visited all the schools, and school children has actively participating in particularly the yoga sessions and even the awareness programs and dietary practices and everything. So how whether you could sustain that activities in the schools now also? Yeah, is there any resource crunch for that?
Is that I pick up, I select a school for every 3 months. For the first month, I talk to the headmistress or headmaster of the school and provide them with a glimpse of what I'm going to do in that school. And for the next 3 months, I continuously talk to the student. And yoga instructor attached to the Orange Health and Wellness Center, they go to them, teach yoga now. And we provide the school health medicines to the students who require medicine for anemia, PCOS or learning disabilities. And we follow them for the next 3 months. Every 15 days we visit them and talk to them about the lifestyle changes, food and the medication they have to attend. And by the end of 3 months, we question them, like on the basis of questionnaire, we assess their progress. This is what I'm doing we are doing in Tamil Nadu. For the next 3 months, we select another school and we try to make changes in their lifestyle. Okay, so you reasonably expect whatever the improvements are supposed to come within 3 months, it is supposed to come. We are providing medication for 3 months, and the lifestyle changes could happen within the 3 months. Like they are taught with the yoga practices for the 3 months, and they can, if they are adaptive, they can change their lifestyle within 3 months.
Okay, wonderful. Yeah, that is what I am asking actually.
What about follow up after 3 months, after 6 months or 1 year? Again, either you go back and seek the.
Sir, our BSK school teams follow the children throughout the year. We, being the single medical officer in the block, can't follow them every 6 months after the 3 months because we have lots of schools to cater to. So
then we cannot capture the data, no? What is the improvement data and all those things? Because we have said for 3 months. So what happened after 6 months, after 1 year, that they are following the same lifestyle changes, whether their health condition is sustaining, improvement is sustaining. Whether you assess after 3 months, what is the...
Orally, yes sir.
What is the feedback?
As we visit them every 15 days, until the end of 3 months, it's good, sir. As I said, we don't follow them after 6 months or 1 year. So hopefully they are doing
I think it's from state programs, no? State Ayush programs.
No, actually there is a support from the Government of India also for the school health program.
No, under state Ayush mission?
They are a national Ayush mission,
then
yes.
you can propose for that, no? You can hire 1 or 2 doctors to have follow-up, at least just 1 day after 6 months, 1 day after 1 year.
Okay, sir.
1 day after 1.5 years. So, different milestones, timeline. Just have visit and take the feedback. You need not do any intervention. Whether those lifestyle changes are sustained, continued or not, that is one thing which we are interested. And whether the health conditions has been improved, and if they want any medication for Siddha, where they are going after those 3 months, what you have intervened. Those information if you capture, and you have to link them to any nearby Siddha dispensary. At least you should make them aware that this is the facility which is near to your college, school, college or vicinity. Those things if you make that will they can utilize. And
That-
in the follow-up you can capture those information.
Yes.
Sure, sir, we'll do that.
Yes.
The RPSK team is going to that same school.
Yes, ma'am.
So what is the linkage or what is the integration that you
Ma'am,
are
RBSK team is conducting adolescent screening campaign and they are giving us the list of anemia children. We are providing them with
Interventions.
medication, and before that we are providing a lifestyle modification session to the students.
So once you finish after 3 months,
Yes, ma'am.
we've already identified, say out of 100 children, we've already identified there are 10 people approximately who are anemic and 10 who have PCOS. We've put them on Siddha medication.
Yes, ma'am.
So these 20 can easily be monitored by the RBSK team.
Of course,
You
ma'am.
yourself can take just a feedback from the RBSK team.
We are doing that, ma'am, but it's not written. Like we talk to each other friends in a friendly manner.
That
Yes.
is what you are planning. Instead of having two separate systems,
Yes.
they will also go to the same school.
Yes.
RBSK will also go to the same school. They will
Because
also
in the
diagnose
field level,
anemia, they will
somehow, whatever the guidelines are issued in the field level, that kind of integration is yet
No,
to
we never
happen.
diagnose, madam. They will diagnose everything and they will give the list of the people who are sick, and then we will follow the people.
But what is the, like, suppose there are 10 children who have been identified by RBSK as anemic and 10 girls identified as PCOS. What is the uptake of Siddha by these 20 children? Will they follow Siddha only or will they be following both Siddha as well as allopathy also? Because
That-
PCOS is very
That data has to be taken properly.
stylish nowadays.
Most of the people, they have integrated
So
medicine only.
I think more important than this thing is finding out whether they are actually
Yes.
continuing with the
Yes.
Siddha medicine.
Medicines.
That is more important rather than seeing the other things.
Yes. Yes.
So the
So
uptake
follow up.
of-
That means ultimately there is a need of regular follow up.
Yeah, we need to have a regular follow-up, like how many are taking Siddha medicine alone, how many are taking
That
both
should be
medicines
Yeah, so
combined.
in that 3 months, have you seen
The outcomes,
no, I'm not talking about the outcomes.
Okay, ma'am.
I'm talking about compliance.
compliance. Yes, ma'am.
We are not bothered about the outcomes because outcome you can't measure.
Yes, ma'am.
You are not going back after 3 months.
Yes, ma'am.
So nobody expects you to measure the outcome or even the output also. We are not even expecting that there will be a 1 gram change after 3 months. But you have to see the compliance. That is what we want to assess, no? Ki whether the children are, or the parents or the children, whoever you are targeting, whether they are actually going ahead and having 3 months of that medication or not.
Students who are taking medication for PCOS are compliant. Like they take up the medicine regularly, ma'am, because they accept the severity of the condition. They are aware of the condition. They should be treated. But about anemia and learning disability, they are not compliant. Like
This is something which
Anyhow, just I want to know about that one actually. For regarding the STGs, our proper whatever we have discussed just now. If any other further comments are there, otherwise we can have that closing function actually. Any other persons want to discuss any point? So you are very clear about what you are supposed to do within next 3 months. Okay, Matai.
I would like to thank CHEB for organizing such a wonderful training program. And actually, sir initially said within 3 months
Yes.
we should cover the training to
Yes.
other MOs
Yes.
in the respective states.
Yes, yes.
Whether there is any guidelines or how to do such trainings,
Mhm.
because in Kerala we are around 80 to 100 Siddha doctors is practicing in government sector. So we are different zones will be there. So if the guidelines,
It's very easy actually.
Yes.
Say only 80 to 100 at
Correct,
a
correct.
single batch you can call at a once suitable place and
but
one
still,
day or 2 day
still
program
how
that we
long,
can have.
what is
Uh-huh.
the training schedules, everything
Yes,
is
yes, yes. Actually,
something is-
only we can suggest you some model training schedule and training load and the number of resource persons like that we can share with you. So you two already, you have already participated. You will be the resource persons, and if additional requirement are there, then you can just post to NIS, National Institute of Siddha. They will help you actually. So you can conduct the training program. There won't be much problem for you.
Okay.
In Tamil Nadu, you have to make it a zone wise actually, either from the north, south, west, like that, and so that the entire persons has to be trained over the next 3 months actually. So what we will share you, whatever the PPTs available, whatever the this videography, whatever the format that we will be saying to you actually within next couple of days, that we can share with them actually.
This will be
Whatever format that we will inform you.
Also, so the pattern of training, if it will be sent to the National Ayush Mission
Ah.
office at
Yes.
Trivandrum,
Yeah.
then it will be helpful for us to do.
Definitely, definitely, and we will make a copy to you also whenever we are writing to the state Ayush department, that we will ask the NAM divisions to do like that actually.
Thank you, sir.
guidelines will be
Ah.
given by the Ayush.
Understood.
NAM will write to all the states.
Hmm.
All the guidelines and everything will be given by them. The videography of the whole session, we are going to upload it on YouTube. So the YouTube channel of CHEB, we are uploading all these, like Siddha, Ayurveda, there's separately we are putting up. And other than that,
Yes, ma'am.
the guidelines and all the requisite communications to the states and all will be done by Dr. Raghu with all the things, with all of you in CC and all. As far as the material is concerned, the hard copy has already been shared with you. The soft copy of this is also will be shared. The video of this whole session today will be loaded onto the YouTube channel, our YouTube channel, and from there it will be easily accessible to everybody, because it's not possible to send an 8-hour video on email also. So if when you take your trainings and you want to share it, then also it will become a challenge for you. So we are uploading it onto our this thing, so anybody can access it from any place. So that will be there, and I don't think it will create much of an issue. I think for Tamil Nadu maybe, but for Kerala I don't think it will be much of an issue. But my suggestion is 50, 40, 50 is a good number to manage. 100 in one batch will become unmanageable for you. So I think you can easily do it. Kerala will not be an issue.
Excuse me, sir. In Tamil Nadu, there are 50 medical officers to be recruited for this program. In some districts, they are recruited, and in others, they are yet to be recruited. Are they need to be trained, or are all the 1,200 doctors need to be trained?
Appropriate actually, because when they are recruited at that time itself, the induction training you can give. That would be the area. It would be more appropriate actually. While they are recruiting, they can start their functions by an induction training of 1 or 2 days program. That would be appropriate.
So all the doctors, all the 1,200 doctors, the doctors in the state needs to be trained along with the 50.
Yes, because STG is not for only for a. That is what I initially mentioned actually. STG is for all the doctors available in the public health facilities. Later, we would like to extend the what you call the STGs into the private sector also. Ultimately, you can think that in the future actually, whenever the clinical establishment rules and everything is actually stabilized in the country, these STGs are a part and parcel of that. So at present, we will be implementing for the public health doctors, but later stage it will be coming into the private sector also. So this would be very useful to everybody.
Thank you,
Sir,
sir.
STG is
likewise
also
it-
important for insurance. So whatever insurance reformations that are going on, so now Ayush has to be treated on par with allopathy as per the IRDA guidelines from April 1st. Now, once insurance companies want to empanel Ayush facilities, whether government or private, they want to ensure that you should follow some standard treatment guidelines. So that's why this should be percolated to entire medical fraternity. So that is our mandate, and first we should concentrate for the public service, then private services also. It is the duty of public service, those who are in public service, to train the private service people also. So that's why it's very important. and it is going to be mainstream health in the future.
Like in Tamil Nadu, 50 doctors are recruited for the same. Is there any idea to recruit new doctors in Pondicherry state also?
State has to decide.
Actually, regular recruitment is under the provision of the Union Territory of Pondicherry actually. But as far as under the National Ayush Mission for a specific program, the UT has to submit its proposal to the National Ayush Mission through the State Annual Action Plan. So they will appraise it. If it is found to be feasible, then they will approve it actually.
Okay, thank you.
This program is exclusive for Siddha, Ayurveda,
Huh.
Unani and homeopathy.
Yes, yes.
So there is no role for yoga doctors.
Yoga is already inbuilt in these guidelines actually, you can see it actually.
Yes, yes.
So as and when we feel that there is a, because as a standalone manner, if you are able to manage in institutions for the musculoskeletal disorders in very specifically, then we will come up with the additional guidelines for the naturopathy and yoga also. So we have discussed with the concerned research council also in this regard actually. Currently all the yoga asanas whichever relevant and pranayama whichever relevant is already inbuilt into these guidelines, whether it is Siddha, whether it is Ayurveda, homeopathy, Unani, uniformly.
Yoga is so far not regularized in the central lab, by the central lab. So there will be implementational issues also. So once that will become part of the central act and entire education system is regularized and registered medical practitioner status is given, then only we can implement them as an independent therapy. Otherwise it will be part of the other systems only, other recognized systems.
So can we go now?
It's the time to conclude this enriching training program. To grace this session, we have with us Dr. Kaustuba Upadhyay sir, Advisor, Ayurveda, Ministry of Ayush. I kindly request our Director Ma'am, Dr. Gauri Sen Gupta, to welcome sir to the event. Thank you, ma'am. Now we kindly request Dr. A. Raghu sir to felicitate our expert speaker, Dr. G.J. Christian. Dr. Kaustuba sir to felicitate our another expert speaker, Dr. Mahadevan sir. So we can go. We can start with the certificate distribution. Dr. Smita A. from Kerala. Dr. Jijimol VC from Kerala. Dr. Chandra Prabhu. Dr. Mithun C. and Dr. Sriraj ER from Kerala. Dr. Rajalakshmi, Dr. Jayanti, Dr. S. Punita from Tamil Nadu, Dr. A. Muneeshwaran, Dr. Vetrivendan Dr. K. Divya, all from Tamil Nadu. Dr. K. Divya, Dr. P. Tavamani from Tamil Nadu, Dr. M. Elangovan from Tamil Nadu, Dr. Pari from Tamil Nadu, Dr. S. Vasant, Dr. S. Sharanya Shalini, Dr. Tamare Selvi, all from Tamil Nadu.
Congratulations to all trainers. It is for the first time we are formally made these standard treatment guidelines for Siddha system in musculoskeletal disorders, and this training is going to be have lot of impact in the field, because you are the people who will going to take this training to the field, and your work is very much important, very crucial for execution of lot of implementation aspect of all the government policies in Ayush sector. See, SDGs are prerequisite for treatment of any human being, mainly for insurance sector and other formal sector. If you don't have SDGs, it is very difficult to capture the data and assess what is the changes that has happened, because everybody says I will give treatment according to my own discretion, and we cannot capture the common points. So what is the your intervention has achieved exactly in the field, in the health of the patient, that is very much important. And that's why all the insurance people, whenever they want to give coverage for insurance, they will insist there should be STG. So we may make policy that insurance should be extended to all equally, but if you don't have implementation aspect, for example, you have STG, you have empanelment, all those things, if you don't have, then it cannot be implemented practically. Even the policy is there, but in the field nothing will be there. Further, many people will not have same standards. If you don't have any training like this, the treatment standards in different facilities will be different, and one who are very good at the implementation or taking your science to the people, they will achieve and they will get name, fame, everything, but other parts of the state or country, they will be deprived of those facilities, and there will not be much demand. For example, madam has told there is no much demand for the mother's care when for the second or third time when they go for consultation. That is because that attraction will come only when you make it standard, and the patient should feel the benefit out of that. Once they will get the benefit, they will definitely come. I think NIS Chennai has got very good OPD coverage and IPD also. Lot of demand is there. So if we are able to deliver properly to the public, there will be public demand. If we fail in our delivery, then we will not able to take our systems to the public. So SDGs will help a lot in ensuring that the benefits of this science, this traditional science, will reach to the people and demand will be generated. Because unless we give the benefit, there will not be demand. So I request all of you to take this task seriously. Within next 3 months, we are supposed to train all the doctors in your territory. So you will be successful in achieving those targets. and next year implementation, the impact of this training should be reflected in your reports. That's what expectation. Last year, I think 2 crores, I think total OPD seen by the Ayush facilities across the country. That should be doubled once we effectively carry out these things. So it will be doubled. It is not a difficult thing. Problem with us is we don't have standard treatment guidelines. We will not able to carry the messages to the people uniformly. So if this training is successfully carried forward to the field, then I think we can take the and convince the public that what is the benefit of this system and how to continuously follow those things. You may be treating the patient, for example, 3 months. 3 months is very limited period. Patient has to continue with those lifestyle changes and medicines for years together. Then only they will have a complete recovery. So that awareness we have to create within that 3 months period. This is not for the 3 months. This you have to continue for this much of duration for complete recovery. And you have the facilities, nearby facilities around your, wherever there is nearby facilities, you should make them aware of those facilities of Siddha at their places, so that they can get the follow-up there. So that will complete the cycle. Otherwise, we have done the government program, 3 months we have surveyed the people, we have trained them, we have treated them, and forget. Then it will be of no use. So that's why my request is, ensure that during those 3 months also, your doctor should communicate to the patient that this lifestyle changes should be for longer duration, and medication whatever required as per the disease, it has to be taken. And anemia, actually all the Ayush treatments are very much popular in the clinic, because I worked in CGHS for past 25 years. So anemia, because medicine's palatability is acceptability is more for Ayush medicines. But if we are not able to convince the patient that it is for longer duration, they will neglect. It is because not of lack of awareness that is causing discontinuation for Ayush system. For allopathy, okay, there may be some reactions and they may not be comfortable with iron supplements and all. But Ayush, there is no problem with the palatability and acceptability by the patient. So if we convince them that these treatments is for longer duration, during our communication with the patient, I think they will follow. It is not difficult, and all the state facilities will have these medicines commonly available in their facilities. So that should not be an issue. So I request all of you to take this as in a mission mode and complete your training effectively within next 3 months. Thank you all. My first training in government services was
Wonderful.
99.
Very nice, very
In the
nice.
year
Then I will
99.
take over this thing. Okay, so because Deepa is not around, I hope my team has taken good care of you since morning. Everything was up to the mark. Nobody had any issues, even for those people who come from outside, I think. Right? So thank you once again. I was not there to welcome you people in the morning, but I'm thankful to Upadhyay ji. बहुत important one word that you said is awareness. There is a lack of awareness. So Central Health Education Bureau's first mandate is creating awareness. So awareness generation material, I assure you, we'll be able to work with my colleague Dr. Raghu and all, and we'll be able to develop any kind of awareness generation material that is required specifically for various sectors and all that stuff. Apart from that, one of the other mandates of CHEB is also all sorts of training programs, right from orientation, sensitization to modular trainings. We're in the process of developing multiple modules along with ICMR and all. So as far as awareness generation trainings and behavioral research or implementation research is concerned, because we are all the arms of the same ministries and we all are working together in the same health sector, so I assure you CHEB will be able to assist you in any format. The URL is there with you. There are a lot of IEC materials which are available, which are freely downloadable.
In case you wish to regionalize it in Tamil or in Malayalam or in any other language, all you need to do is write just a one-line email to the director CHEB that we would like to use this particular material to be regionalized, and all we ask is please retain our logo, that's all. So everything is available, and whatever we do, we put it up on our own website, we put it up on our own Twitter handles and on YouTube handles and all that stuff, and everything is available for all Government of India officials across the country. So that is something which I wanted to share with you people, and I hope you will have wonderful state level trainings and below district level trainings also. Over to you, Deepak.
I'm leaving today. अभी केरल जा रहे हैं।
May I kindly request our director, Ms. Dr. Gauri Sen Gupta, to felicitate a resource person, Dr. A. Shakti Parkavi. So now we can join for a group photograph.